Hi, my name is Dr. Coffler. I'm a board-certified reproductive endocrinology and infertility specialist with HRC Fertility in San Diego and Orange County. I have been with HRC since 2008, and I enjoy every day working here. I did my medical school. I started at the Rappaport School of Medicine in Haifa, Israel, at the Israel Institute of Technology. And upon completion of medical school, I proceeded with an OBGYN residency at the Rambam Medical Center in Haifa, and I became a board-certified OBGYN in Israel. I subsequently moved to San Diego, where I was very fortunate to be accepted into a research and clinical fellowship program in reproductive endocrinology. And I then completed several clinical research projects in the field of polycystic ovary syndrome. I moved to Cleveland, Ohio, in order to complete a OBGYN residency here in the US. And after 3 years, I relocated back to San Diego. I completed a formal fertility fellowship at UCSD. So one day, I was working with one of our mentors, and she showed me actually the first time how they do pre-implantation genetic diagnosis. And keep in mind, this was a few years ago when I was a resident, and this was just the beginning of this technology being used. So when I looked under the microscope and saw, those cells that were actually removed from an embryo, and at that time we used a technology that was called FISH, F-I-S-H, and we looked under the microscope and we were able to actually see, quote unquote, we were able to see the chromosomes, and we were able to identify that an embryo has a normal number of chromosomes and another embryo has an abnormal number of chromosomes. And that was, so this was science, but it was not just science. I felt at that time that this is like science fiction. And I realized that this is where I want to be. I want to be at the forefront of science. I want to be really at the edge of science or science fiction. And from that point, things just accumulated and guided me to that, to that field. And the second thing that happened later was actually the evolution of the stem cells. And the stem cells, they were initiated. The stem cell origins was actually started with stem cells from embryos that were created with IVF. So when I realized that, and I kind of thought, I kind of dreamed, what's the potential of that? I knew again that that's where I want to be. One of the things that I am trying to educate my colleagues is that fertility services are not really limited only to helping patients become pregnant. We can actually help patients have healthier children. So for example, by testing embryos prior to transfer, we can eliminate genetic disease, and we can eliminate or reduce the chance of hereditary cancers. We know that the vast majority of miscarriages, of spontaneous miscarriages, are related to genetic abnormalities in the embryos. And by employing technology of identifying genetically abnormal embryos, we make sure that we transfer a chromosomally normal embryo into the patient's womb, and therefore reducing the chance of another pregnancy loss. I'm married for 30 years to a wonderful woman. She's a dentist, and she tolerated me for all these years, so she must be great. We have 4 daughters together. Family is maybe the most important thing to me, and I realize really how important and how blessed I am to be able to accomplish that without a lot of difficulties. My second daughter, we actually had some fertility problems conceiving her. Fortunately, it didn't take a lot of treatment efforts in order to be successful, but it was nerve-wracking at the beginning, and then we had her. So we're very blessed. We have those 4 daughters, and we enjoyed seeing them growing and spending time with them. And actually, it might sound a cliche, but really the thing that I enjoy most is spending time with my family. We're just happy to see them going their own way and being successful in their own way. I'm so fortunate that, as I understand that, I understand what's the meaning of family. I'm so fortunate to be able to help other people accomplish this same goal. Okay, when you become my patient, you will be taken care of by me personally, and I will take care of you from A to Z, making sure that your care is very well coordinated and results in the most successful possible outcome. You will notice that one of the things that me and my team are very particular about is that we care. And we care about our patients, and we care about our outcomes, and we do everything possible to make you feel as an individual, and definitely not as a number. My name is Dr. Mickey Coffler. I'm here with HRC Fertility in San Diego and Newport Beach, California, and I'll be looking forward to be able to help you accomplish your goals.